The pandemic reminded each and every one of us just how important our health is. It also put enormous pressure on our healthcare systems and on our healthcare workers. And it made us take a hard look at the long-standing issues facing our healthcare. As leaders, we've come together to deliver tangible actions and outcomes today while building a more modern system to ensure results for all Canadians for the future. The provincial and territorial governments deliver healthcare with support from federal funding, which ensures that our collective commitment to the Canada Health Act is upheld. In fact, it's written right into the Canada Health Act that as governments, we need to protect, promote, and restore the physical and mental well-being of residents of Canada and facilitate reasonable access to health services without financial or other barriers. To help ensure that, we're announcing that the federal government will be providing $198 billion in additional federal health funding over the next decade. This includes planned increases to the Canada Health Transfer and new funding of $48 billion over the next 10 years. Obviously, this is a major federal investment in healthcare. But we all know that money alone is not the answer. Each province and territory is facing different challenges. That's why we're focused on negotiating 13 distinct bilateral agreements that will respond to various situations across the country. This will make sure that real improvements are made and accounted for, particularly in 4 priority areas: primary care, healthcare workers, mental health, and health information and data. First, primary care, making sure Canadians have access to family doctors and nurse practitioners. It's about having someone you trust, who knows you, your kids, your parents, your grandparents, and who will make sure that everyone gets the right care and finds the right specialists. A family health team is there to be your entry point into the healthcare system, so it doesn't have to be the emergency room. Third, we need to make sure that Canadians can get the mental health care they need. 1 in 3 Canadians are struggling. The good news is that more and more people are bravely putting their hands up and asking for help. But we need a system that can respond and help people when and where they need it. And that includes helping those living with substance use and addictions challenges. Each of the 13 bilateral agreements will be focused on delivering results for Canadians, to make sure that you're getting your hip replacement faster so you can have your quality of life back sooner. Bilateral agreements will be tailored and flexible to the needs of each province and territory, but one thing will be consistent. Each will need to provide transparent information so that your healthcare system is accountable and you can be sure that real improvements are being made. What gets measured gets done. No matter your income or where you live, you deserve access to the best possible care from coast to coast to coast, whether you live somewhere remote, rural, or urban. Indigenous peoples have their own unique health needs. They continue to face gaps in care at all levels, which are especially felt by those who require wraparound services. Every Indigenous person deserves equal quality and equal access to healthcare, free from racism and discrimination. So as part of the bilateral agreements, we will work with Indigenous leadership to address these issues and make sure there are measurable results. And we are providing $2 billion over 10 years to an Indigenous Health Equity Fund to support First Nation, Inuit, and Métis partners in closing healthcare gaps. Healthcare has always been a priority for our government. Since 2015, we've made major historic investments to support Indigenous health. In 2017, we signed health accords with all provinces and territories to improve mental health and addictions care, as well as home and community care for all Canadians. We'll be asking provinces and territories to recognize credentials Canada-wide so that our well-trained healthcare professionals can work wherever there is need, and to improve how we recognize foreign credentials so that skilled people who come to Canada can more easily contribute and reduce pressure on overworked staff. Personal support workers take close care of people and deserve to be fairly paid. That's why today we're investing $1.7 billion towards the goal of $25 an hour for their important work. But most importantly, in order to support Canadian healthcare workers, we're taking steps to keep our public system strong. This is a big country, built on big, progressive ideas. And few are more central to who we are as Canadians than the promise of universal, publicly funded healthcare. We all pay our fair share, knowing that, unlike a lot of places, we don't have to make the choice between paying the mortgage or getting a much-needed surgery. And we like to know that our neighbor doesn't have to make that choice either, no matter their circumstances. So when it comes to healthcare, we need to make sure to look out for everyone and leave out no one. We're taking action today so Canadians can continue to have trust in our public system. We know that cuts and austerity won't make us stronger and won't help Canadians thrive. We're investing in the well-being of Canadians and in a strong social safety net, not only because it's the right thing to do, but because it's the smart thing to do. Canadians deserve to know that every new dollar being announced today is exactly that, a new dollar that will go towards the improvements in healthcare that Canadians need. Because when people are healthy, when people don't have to go into unnecessary debt, when people can get timely access to healthcare before complications arise, all of it makes our economy stronger. Now is the time to step up, to meet this moment, to do what it takes to reinforce the defining Canadian institution that is universal public health care. I have high expectations, but also reasonable expectations that in the coming weeks, not months, we will conclude bilateral agreements, begin flowing more money, and Canadians will start seeing real results. Let's get this done. Let's give Canadians the healthcare that they expect and that they deserve.